So, good morning, everyone. Thank you for joining. We still have a few attendees who will join soon, but we will start the webinar now. Please note that this session is being recorded and will be made available through EMA YouTube channel. Through the sessions, you will be able to ask questions and give your input via our interaction tool, Slido. The details of Slido will be shared soon and are available for you throughout the webinar in the chat. Please do not use the chat. So my name is Isabel Shisharu. I am responsible for the SPOR data services at EMA. And today you will be joining in the morning a session dedicated to the referential management services. So welcome for your interest in our presentation. We've had a few of these webinars already, and we typically focus in our processes on the change request process, the process whereby you can request new and updated terms to RMS. Today, we've added a few more extra interesting points for you. We'll cover a holistic overview of the RMS processes in point 3. We will share with you a little bit on our statistics and how we're performing, in case you're wondering the volumes of work and how we're adhering to the SLAs. And throughout the end of the session, we'll also cover how RMS is used in projects, which projects we have in the pipeline for 2022, and a little bit of an insight on our current and future RMS activities. Throughout the session, please use Slido to write any questions that you have. We will be looking at Slido and trying to address them as the session goes on. You can vote which questions you share the interest in, and those questions will be addressed at the end. And questions that we do not have time to address during the session will be answered in an FAQ document that we will publish in the SPOR portal. So please use the Slido to ask any questions that you have throughout the presentation. Vote on the questions of more interest to you so that we can address them at the end of the session today. And we will attempt to publish all of the questions in our portal eventually. So having said that, I now hand over to Jaume Gonzalez, the referential specialist, and I wish you a good webinar.
Hello, good morning, everyone, and thanks, Isabel, for the introduction. My name is Jaume Gonzalez. I'm the Master Data Manager and Business Lead for RMS, which stands for Referential Management Services. And today I'll talk to you about the RMS services and activities. So let's start with the basics. RMS was created as a solution to implement ISO standards 11239 and 11240, which relate to pharmaceutical dose forms, units of presentation, routes of administration, packaging, and units of measurement. And this is for the identification of medicinal products. And RMS is essentially a repository of lists or controlled vocabularies and terms that are typically needed for regulatory purposes. So at the time of this recording, which is March 2022, RMS contains 154 lists. And as you will see later in the presentation, these numbers have grown since the creation of RMS back in 2017. And these lists belong to different maintenance organizations, such as EDQM, WHO, MSSO, and also EMA. And we will see more details on this later. Now, RMS represents a centralized and single source of referential data to support regulatory processes across the EU regulatory network and the pharmaceutical industry. And last but not least, as I said, RMS went live in June 2017, and that's when it replaced EUTCT, which is the system that previously held all of the vocabularies that I was referring to, and a backward compatible API that mimics EUTCT was put in place at the time of this go live to minimize impact for users. In terms of target operating model, the RMS services include data content, new processes, functional capabilities, and the team of data stewards as follows. So specifically, RMS acts as the central repository and provider of referential master data. The model includes a Spore web portal and an application programming interface, also known as API, to access RMS data. A new process was created to register and update referential data. And very importantly, there is a team of AMA data stewards to manage data, and they do this using consistent data quality rules and to provide support to stakeholders. As explained in the previous slide, at the center of the target operating model, we have the RMS services, which are the central repository and provide services around referentials master data. To the right of the slide, we have maintenance organizations such as EDQM, MSSO, WHO, and others from which EMA consumes data. And to the left of the model, we have users and consuming systems, which can be industry, NCAs, or EMA stakeholders, and these consume data from RMS. Now, for the specific case of EDQM, there is a particular model, as you can see in this slide. So going from left to right, RMS users can submit a change request to create or update a standard term. This request will be validated by the RMS team, and assuming that the validation is positive, the RMS team will then liaise with EDQM as they are the owners of the standard terms. EDQM will then assess the request and update their database as needed. And the RMS database will be automatically updated through the EDQM to RMS synchronization, which takes place on a weekly basis. Now, it's important to bear in mind that regulatory procedures can start as soon as the new term is published in RMS as provisional, and we will see later how this works. And the term should be final by the time that the regulatory procedure reaches a conclusion. As mentioned earlier, as of March 2022, RMS contains 154 lists from different maintenance organizations. EMA with 134 lists is the owner of most of the lists in RMS, but RMS contains other lists such as the pharmaceutical dose form, the combined terms, the routes and methods of administration, and up to 16 lists that belong to EDQM, as well as lists such as the language list from ISO, the MEDRA list from MSSO, and the ATC human and ATC vet lists from WHO. The aim of this slide is to show what NCA users and industry users can and cannot do in RMS, and this is according to the list owners. So starting with the NCA users, which are the, let's say, the top 3 lines, they can download and access all lists in RMS with no restrictions. In terms of requesting changes to lists, this is possible for most lists with 2 exceptions. The first is the MEDRA list, for which any changes should be requested directly to the maintenance organization, which is MSSO. And the other exception are the ATC human and ATC vet lists. And in this case, the request should be sent first to WHO as the maintenance organization, and then to EMA. This is probably a good time to explain that in RMS, we publish the updates of the ATC human and ATC vet lists on a yearly basis at the beginning of the year, and this is following the schedule from WHO. Therefore, even if we don't receive a request for a specific new ATC code approved by WHO, that code will be published in RMS with the next yearly update. Having said this, if there is a new ATC code, be it provisional or approved by WHO, which is needed for a regulatory procedure, and that code is not yet in RMS, then the user can submit a change request in RMS, and subject to validation of the relevant documentation, we can quickly publish that term in RMS to enable the regulatory submission. Concerning the creation or update of translations, NCA users should be able to provide those for all EMA-owned lists, as well as for the units of measurement list and the ATC human and ATC vet lists. And the two lists for which it's not possible to provide translations are the EDQM lists and the MEDRO list. And the reason for this is that they have their own mechanisms for the provision and the maintenance of translations. Now, if we look at industry users, which is the bottom three lines of the table, they can download most of the lists in RMS as long as they are logged in, with the exception of the ATC lists and the Metro list, and this is for property reasons. So access to the full list for these two lists should be only through the relevant list owners. Now, industry users can submit requests for changes for most of the lists in RMS, with the two exceptions being, again, the ATC lists, for which the request should be sent first to WHO and only then to EMA, and the Metro list, for which MSSO, as the owner of the list, should be contacted directly. And last but not least, industry users are not expected to provide translations for any of the vocabularies in RMS. Now, I will not go in detail through all of the functionalities in RMS, as there is an RMS web user manual under the document section of the RMS portal, which contains comprehensive information on this. But I would like to give you a quick overview of what users can do in RMS. So in terms of searches, users can do simple searches. They can do more complex searches using filters, and then they can save those complex search queries so that they can be reused at any point in time in the future. Users can also browse the list of lists. They can view the terms within a given list. They can also see the details within specific terms, and they can browse the list information document, which I will discuss later. RMS allows users to export full lists or specific selected terms or translations within a list, with some exceptions as explained in my previous slide. And this can be done in either format. Users can search, view, edit, or delete change requests, and they can submit change requests to either create, update, or delete terms, or to create or update lists. RMS also allows users to group terms within a list or across lists, and this is through the use of tags. It has a subscription functionality to inform users via email whenever the selected lists have been modified. In terms of translations, these can be searched and viewed through the RMS portal, and NCAs can provide translations either online and offline. And as mentioned earlier, more details on this can be found in the RMS web user manual. And as a final functionality, there is a documents area in the RMS portal, which contains important documentation, both general and technical, as well as information for NCAs. Earlier in the presentation, I referred to the list information document. And at this point, I'd like to explain that this is a document which you can find in the RMS portal next to each RMS list. And it contains important practical information on every single RMS list, such as the description, where the list is used, whether it belongs to the human or the vet domain or both, who the list owner is, whether the list accepts change requests or not, how the validation and approval processes work, etc. So you can see all of the headers of the document in the slide. So as mentioned earlier, each list in RMS should have its own list information document, and you should be able to view it by clicking on the document icon that you can see next to the red arrow on the screenshot. And the part below in the bottom of the slide is basically a screenshot of one of these list information documents, just an example. In terms of business particulars for RMS, EMA can process and validate all change requests and create provisional terms as a result. RMS can finalize and approve change requests for EMA-owned lists and for change requests involving externally managed lists. The support team will liaise with the relevant list owner. And just as a reminder, the list information document is one of the places where you can find details on who the list owner is, but you can also find this information in the list of lists view, as you can see below marked in yellow. Now, the next section is to describe what are the processes done in RMS. So one of the main areas of work in RMS is under the category of data stewardship. Within this category, we find processes such as delta updates and periodic updates of RMS lists, such as EDQM lists, MEDRA, VEDRA, the ATC human, and the ATC vet list. The management of change request tasks submitted by RMS users also fall under this category. And this includes tasks to create or update terms or lists. Data stewards can also create, update, or delete records directly in the RMS database. And this is done outside of any change requests. Then another group of processes corresponds to activities related to EMA Service Desk, from which the data steward will be assigned specific tickets related to RMS. And these may be either data quality incidents, data quality questions, IT incidents, or other type of questions. There's also a plan to implement data quality management activities. And this is what you can see on the right part of the slide. But there's nothing concrete at the moment, so I will not expand on this today. And it's also important to mention that the RMS team, together with the OMS team, meet regularly with the key user group to identify areas of improvement for any of the processes that I just mentioned. So just as a recap of what we've seen in the previous slide, the data in RMS is basically being maintained through different processes led by the data steward. So for example, there are continuous updates from external providers, such as with the EDQM lists, and this is done through the EDQM and RMS synchronization process. And there are other periodic updates from external providers, such as the yearly ATC human and ATC vet updates from WHO, the MEDRA update from MSSO, or the VEDRA update from CVMP. Data changes can also be triggered by change requests raised by either internal or external users to create or update data in RMS. In the case of term change requests, SLAs will be typically 2 to 5 working days for validation and creation of the provisional term, and 1 to 2 months for the final approval of the term. And in the case of list change requests, SLAs may range from 2 to 6 months, depending on the complexity of the list and the need to consult with subject matter experts. And as a reminder, data stewards can also create, update, or delete records directly in the database. As I said, this will be done outside of any change requests. And this would be typically done to make corrections of typos or updates from minor systems or for activities that are linked to legacy. This slide gives a quick overview of how service desk tickets are handled. So going from left to right, the process starts with either an internal or an external user raising a ticket related to a system issue, or to follow up on an issue with a change request, or perhaps concerning access issues or requests for information. Service desk will analyze the ticket and triage it according to the nature of the issue and the teams that should be involved and the relevant SLAs. If it's an IT issue, then the ticket will be assigned to IT support, who should then fix the issue with the system, and this will be the end of the process. If, on the other hand, the ticket is a business issue or a data issue, which could be an IT incident, a data quality incident, a data quality question, or any other type of questions, and you can see examples of all of those in the slide, then the ticket will be assigned to an EMA data steward. The data steward at this point will analyze the ticket and do their best to resolve the ticket within the given SLAs that you can see in blue on the right part of the slide. And they will involve IT support whenever this is needed. Now, for IT incidents, the data steward will typically suspend the ticket, inform the user, and raise a new ticket for IT support to handle it. For data quality incidents, the data will be corrected in RMS if changes are considered necessary. For data quality questions, these will be collected and shared with the key user group. The impact on data quality rules will be analyzed and data may be fixed if this is considered necessary. And for other questions, as for any other type of tickets, we will acknowledge receipt and we will aim at providing an answer within the given SLA. So we're now more or less halfway through the presentation, and the next section is to give some information on RMS statistics, to give an idea of the amount of work and the growth in RMS. So in terms of volumes, you can see that between 2020 and 2021, the number of terms in RMS increased by more than 4,000 terms. And this was mainly due to mapping activities between Article 57 and RMS, as well as UPD and EVVET3 implementation activities. In terms of lists, which is the graph to the right of the slide, there was a slight increase of 5 lists from 2020 to 2021, and this was linked to work in the areas of PMS, UPD, IRIS, and EVVET3. But there's a much bigger increase of 17 lists between 2019 and 2020, and that was mostly due to new lists required for EVVET3 implementation. If we look at the number of change requests received for RMS in 2021, there was an increase of 130%, as we went from 304 requests in 2020 to 702 requests in 2021. And this was mostly related to mapping activities between Article 57 and RMS, and to the implementation work for EVVET3 and UPD. When we look at SLAs, and this is the table to the right of the slide, we see that on average, 98% of change requests were resolved within the agreed SLAs. Although this is a 2% decrease when compared to 2020, we have to take into account the fact that workload increased by 130% in 2021. And for this reason, we think that in our view, the numbers are very positive. If we now drill down into change request by request type, and this is the chart to the left of the slide, we can see that the biggest increase by far was in the requests to add new terms, and especially in 2021. And again, this is linked to the mapping activities that I mentioned earlier between Article 57 and RMS, as well as the activities to implement the UPD and EVVET3 projects. Another big increase that we observe is in the number of requests to update terms. And we went from 31 in 2019 to 132 in 2020. And this was mostly due to EVVET3 implementation activities. If we now look at the change requests received in 2021 per status, and I'm referring to the Excel screenshot to the right of the slide, the big increase from 2020 to 2021 in requests submitted and rejected was mainly linked to a user who submitted more than 100 requests for testing purposes in RMS production environment. In terms of RMS related tickets received from EMA Service Desk last year, there was an increase of 122% as we went from 36 tickets in 2020 to 80 tickets in 2021. Questions relating to mapping highly contributed to this increase, as well as questions on availability of RMS lists, RMS consumption, and other questions related to integration aspects for UPD, PMS, etc. If we look at the SLAs for EMA Service Desk tickets in 2021, we see that 75% of them were resolved within the agreed SLAs. For data quality incidents, data quality questions, and other questions, the SLAs were slightly better than in 2020. However, SLAs for IT incidents were the most impacted, and this is because most of these incidents were required further investigation by the technical team. In the top part of this slide, we are looking at the frequency of data quality incidents in 2021. And this is taking into account the number of terms in RMS and the number of SPO users. So if we look at the number of SPO users, the data tells us that only 0.05% of users reported data quality incidents in 2021, as there were only 5 data quality incidents reported by the more than 9,000 SPO users. And if we look at the number of terms in RMS, we see that only 0.004% of the terms in RMS triggered data quality incidents reported by users, as there were only 5 data quality incidents reported for the more than 125,000 terms in RMS. So putting all of this into perspective, we can conclude that the level of data quality incidents in RMS is extremely low. The next section concerns the change request process. So typically, the starting point for a change request is whenever a user needs to submit an application to a competent authority, and a referential which is needed in the application is either missing or it needs to be updated. For this, the user should submit a request through the SPOR portal asking for the pre-registration of a new term or for the updating of an already existing term in RMS so that the application can then be completed and submitted. As mentioned earlier in this presentation, users can request change requests through the RMS portal to either create new lists or terms, update already existing lists or terms, or delete terms. In the sake of time, we won't go into more detail through this, but again, if you would like to see detailed step-by-step instructions on how to submit change requests, you can find this in the RMS web user manual, and you have the link in the slide. And if you have any issues or queries concerning change requests, please raise them through the EMA service desk through the link that you can see at the end of the slide. So earlier I gave an overview of how service desk tickets are handled. And now I'd like to explain how the RMS team handles requests for terms and lists. So let's start with terms first. So again, going from left to right, the process starts with the RMS user submitting a request to either add, update, or delete an RMS term, and this request should be accompanied by the relevant supporting documentation. The next step is the validation phase, and here the data stewards will check that the data is appropriate, that it's not a duplicate of another term, that the request has been done for the correct list, etc. And data stewards will use all available guidance and reference information, such as the list information document, to perform this validation. The SLAs for validation of terms are typically 2 to 5 working days, and there are 3 possible outcomes out of this validation. If the request is not clear, the change request will be returned, and there will be questions for the requester to clarify. If the request is considered valid, then the task will be invalidated and the reasons for the rejection will be explained in the notification that the user will receive. And any disagreements or questions post rejection should be handled through the EMA service desk, stating clearly the change request number for easy identification. The third outcome is if the request is considered valid. In this case, the term will be created as provisional, assuming that the request is for a new term, but the term will remain unchanged if the request is for a term update. And the reason for this is that that term is already published in RMS. Now, all valid requests will then go to the next step, which is the approval phase. And this is a more in-depth assessment of the request, where SMEs will be consulted if necessary. SMEs is subject matter experts. The SLAs here are 1 to 2 months, and there are 2 possible outcomes. Similarly to the validation phase, if the request is considered invalid, the task will be rejected. The reasons for that rejection will appear in the notification, and any disagreements should be handled through the EMA service desk. And if the request is considered acceptable, then the term will be updated in the relevant RMS list. The main steps for the management of list change requests are not too different from the term change requests, but there are some differences, the main one being obviously the SLAs. So for list change requests, the process starts with an RMS user submitting a request to either add or update a list. And in this case, the request should also be accompanied by relevant supporting documentation. Similarly to what happens for term change requests, the next step will be the validation phase. And again, here is where the data stewards will check that the request is appropriate, that the list requested is not a duplicate or has a big overlap with another list, and data stewards will use all available guidance and expertise to perform this validation. The SLAs for validation of list change requests are typically 5 to 20 working days, and there are 3 possible outcomes out of this validation. If the request is not clear, the change request will be returned, and there will be questions for the requester to clarify. If the request is considered invalid, the task will be invalidated. The reasons for the rejection will be included in the SPOR notification, and any disagreements should be handled through the EMA service desk. And the third outcome is if the request is considered valid. In this case, the list will not be published yet, as the assessment of the full list will still be pending, but the preparatory work to publish the list will start at that point. Again, similarly to what happens for term change requests, all valid list change requests will go to the next step, which is the approval phase. Subject matter experts will be consulted if necessary at this point. And the SLAs here are 2 to 6 months, and there are two possible outcomes. If the request is considered invalid, the task will be rejected. The reasons for the rejection will be in the email notification, and any disagreements should be handled through the service desk. And if the request is considered acceptable, then the list will be created if we're talking of a request for a new list, or it will be updated if we are talking about a list update change request. The top screenshot here is just to show where to find the change request section in the RMS web portal. So you can see it marked in yellow. And you can also see in yellow the buttons for actually submitting list change requests and term change requests. In the bottom screenshot, you can see the general contact information that is required to submit any term change requests. In this screenshot, you can see the information on the actual term that should be populated in the change request. And you can see marked with a red asterisk the mandatory information. So it's basically the term name and the domain, and then all other fields are optional. The top screenshot in this slide shows the area to search for specific change requests. And the bottom screenshot is an example of search results for specific change requests. Now, as mentioned a few slides back, RMS requests go through two different steps. First is a validation step where the data stewards check for completeness. They check that it's the right type of request, etc. And then in the approval step, this is a more in-depth assessment of the request, and this is where subject matter experts may be consulted if applicable. In terms of term statuses, when a term passes validation, the term is published as provisional. If it doesn't pass validation, the term status will become invalid and the term will not be published. When terms are approved, their status becomes current. And when terms are rejected, their status will either become nullified or non-current, depending on the case. And basically non-current means that the term is still being used in products, but the use of that term is no longer recommended, and an alternative current term should be used instead. In terms of how term statuses fit into regulatory procedures, and I think we've mentioned this earlier already, industry can submit applications to the relevant competent authority using provisional or current terms. And by the time of approval, applications should only contain referentials which are with status current. For details on service level agreements for RMS, there's a SPOR SLA document published in the link that you can see in the screens. But just as a reminder, validation or registration of new provisional terms will take 2 to 5 working days, and approval or registration of new current terms may take up to 2 months, and this is for EMA managed lists. Bear in mind that requests may require consultation with subject matter experts such as EMA committees or WHO or EDQM, and this can have an impact on the resolution time. And for SLAs for externally managed lists that are not owned by EMA, please check with the external maintenance organization. For the validation of new lists, this may take 5 to 10 working days, and validation of updated lists may take 15 to 20 working days. Approval and publication of new or updated lists may take up to 6 months for EMA managed lists. Again, if there is consultation required with subject matter experts, this can have an impact on the time that we take to address the request. And for information on SLAs for externally managed lists, again, the user should check with the owner of the list. A few more statistics on RMS. So since RMS go live in 2017, we have received roughly 1,500 change requests, of which approximately 73% were requests for new terms, and 63% of all change requests received were either approved or approved with changes. In this slide, you can see the ranking of the top 10 lists in RMS, which have historically received more change requests since go live. And you can see in brackets and in bold the exact number of requests received for each one of these lists since the creation of RMS. The statistics also show data on rejections, and specifically we see that 25% of all change requests received since RMS Go Live have been either invalidated at the validation phase or rejected in the approval phase. Below you can see the top 5 RMS lists with the highest number of change requests, either invalidated or rejected. Now, the next 5 slides contain details on why some of these requests for these 5 lists have been sometimes rejected, and it provides some tips on how to avoid this. So they are a bit packed with information, but I'll try to go through this as quickly as I can, and hopefully this will be useful for users, and maybe they can even be used as guidance to submit change requests in the future. So the first list is the units of measurement, which is a collection of units needed to enter information on medicinal products. This list is consumed in systems such as the electronic application form, XCB-MPD, and UPD. Some issues experienced with change requests for this list are, for instance, the confusion between units of measurement and units of presentation. So for instance, we received once a request for a Petri dish to be added as a unit of measurement. And another issue is the fact that some requests include references to what is being measured. And 2 examples of those were milligrams of pili and milliliters of paracetamol, as opposed to how it is being measured. So a tip to avoid issues with this list is to consult with the RMS team through the service desk portal before submitting the actual change request if there is an indication that the request may be controversial. It's possible to add new terms to this list, and this includes legacy terms. And as an advice, which really applies to any list, is to check already existing terms in the list. Another tip is to avoid elements which are not really measuring. So for example, pili and paracetamol in the examples that I provided. So unless so avoid these elements unless this is strictly necessary and considered part of the unit of measurement, such as in cases like, for example, 80% effective dose in rabbit. So in this case, the reference to the animal is needed as this is the name of the laboratory measure. Now, planned activities for this list are for the sport team to liaise with the key user group and to increase guidance in the list information document. And when using units of measurement in a regulatory process, it's important to bear in mind that terms used in product literature and in the electronic application form or UPD, PMS, XMPD, or in any structured product data, these terms should be equivalent, but they may not be a copy and paste or an exact match, as they may have undergone standardization. So examples of this standardization may be the use of singular versus the plural, the use of UK spelling versus US spelling, or the removal of unnecessary information, such as in the examples of pili and paracetamol that I mentioned above. The next list is the pharmaceutical dose form, which describes the physical manifestation of a product that contains the active and or inactive ingredients intended to be delivered to the patient. So this list is consumed in EAF and in XCVMPD, and it's used to describe the manufactured item, which is the item as presented in the packaging by the manufacturer, or the pharmaceutical product in the EU marketing authorization application dossiers for human and vet medicines, as described in the references to the dossier and the SPC that you can see in the slide. Issues with this list often relate to requests for terms which have already been rejected by EDQM or which don't follow the EDQM editorial rules. If you need to submit a request for this list and you suspect that the request may be difficult or controversial, again, we encourage you to contact the RMS team through the service desk portal before submitting the actual change request so that we can discuss in more detail. New terms can be added to this list. And as always, we recommend to check the already existing terms in the list before submitting the request. And in this specific case, we strongly encourage users to adhere to the rules that you can find in the EDQM standard terms guidance, which is available through the link in the slide. As an exception for legacy terms, and in order to avoid blocking any regulatory submissions, requests for non-EDQM compliant terms may be accepted in SPOR, but we would publish them as non-current to make sure that it is clear that those are not official standard terms. Synonyms cannot be added in this list in RMS as they are not foreseen in the standard terms database from EDQM, and translations cannot be provided as EDQM has its own mechanism for the maintenance and provision of translations. Terms in this list can be updated and deleted. This should be requested through the EDQM change request form, for which you have the link in the slide. And this form should be included as an attachment in the change request that should be created through the RMS portal. For this list, the sport team also plans to liaise with the key user group and to enrich the list information document. And in a regulatory context, please remember that standard terms such as pharmaceutical dose form, referenced in product literature and in the electronic application form, XCVMPD, or in structured product data should be equivalent, but again, they may not always be an exact copy paste or match, as they may have been standardized by EDQM. And examples of this standardization for this list, again, maybe the use of singular versus plural, the use of UK versus US spelling, or other naming conventions. As an example, EDQM refers to capsule heart, but we often see in product literature hard capsule. So the two are exactly the same. There's just some standardization done at the level of EDQM. Now, another list for which sometimes raises issues is the special precautions for storage, which describes the possible storage and or transport conditions for a medicinal product under which it can be kept during its shelf life. This information is used in product information, and the content should be in accordance with the note for guidance that you can see on the screens. And this is the document that belongs to the Quality Working Party. This list is consumed in EAF, and it's not foreseen to be comprehensive or exhaustive. The main issue with the requests that we receive for this list is that many of them are very product specific. So for instance, we may receive requests for store below 10 degrees, and another one for store below 15 degrees, and another request for store below 20 degrees. So the list is not foreseen to capture all of these terms as individual terms, as I said earlier. So for the moment, new terms cannot be accepted for this list, but the possibility to review and expand this list is being currently discussed in the context of PMS implementation. So the support team will liaise with QRD and the labeling office at the EMA to identify next steps. The Quality Working Party, as the owner of the note for guidance, may need to be involved in this review process, and we will communicate when a conclusion is reached on this list. In the meantime, as I said earlier, users should avoid sending requests for these lists, and users of the electronic application form that need a specific storage condition that is missing in RMS should select the closest term available, and optionally may provide a clarification as an annex or an appendix to the electronic application form, explaining that they have registered an inconsistency between the electronic application form and the product information, given the fact that the term required is missing in RMS, as advised by the support team. The ATC human list is a classification system for substances used in medicines for human use, where active substances are divided into different groups according to the organ or system on which they act, and their chemical, pharmacological, and therapeutic properties. You can see the link to the list in the slide, and for your information, this list is consumed in EAF, XCVMPD, and will also be consumed in PMS. The main issue encountered with change requests for this list is that many requests concern codes from national classification systems, which are not official ATC codes. The ATC human list in RMS foresees the creation of new codes, as well as the update or deletion of codes. But as mentioned earlier in the webinar, for this, the request needs to be sent to WHO first and then to EMA. And users should include supporting documentation in the RMS change request, such as proof of the code published by WHO, be it a preliminary or a final code. Plans for the future for this list are for the list information document to be updated to reinforce the message that any codes not accepted for review or not approved by WHO will not be published in RMS. Last but not least, a tip to ensure a straightforward regulatory process is to submit the request for a new ATC code to WHO and EMA in a timely manner. And this is to ensure that the ATC code will be final by the time of the approval of the regulatory procedure. And if you require a new national non-WHO official code in XAVMPD, you should continue to register it following the current process. And as far as we are aware, there haven't been any of these national classification codes requested specifically for the electronic application form historically. So this shouldn't be a problem for EAF. But having said this, RMS will follow up with EAF colleagues to check if this may become an issue in the future. The last list to report on is the target species, which describes the species for which the veterinary medicinal product is intended for. It's important to clarify that this is not a taxonomic classification. It's just a practical collection of terms used in product literature. This list is consumed by EAF and UPD. The main issues with this list is that we receive requests for supposedly new terms, which in reality already exist as synonyms of other main terms. So for instance, we received a request for a new term, dove, but this term is already registered as a synonym of pigeon. Another recurrent issue is that we often receive requests for target species which are very generic. And examples of these are small animals or small pets. So in general, these will be rejected as they are not specific enough. And we also have issues related to nomenclature. So for instance, sometimes there is confusion between species and subspecies and varieties and other scientific aspects. Terms in this list can be added, updated, or deleted. But before requesting any of these, we strongly recommend users to carefully consider the meaning of the term and to check the term attributes in RMS, as these often give more context on the term. So for example, it may provide information on the age range, the physiological status, the production type, etc. And as always, we recommend to check relevant terms already existing in RMS, as well as synonyms and descriptions before submitting the request. There has been a group of subject matter experts created to review requests for target species in the context of the recent UPD implementation exercise. As with this exercise, the need for terms in this list was highly increased. And this group will continue to be consulted for future requests in conjunction with QRD as the list reviewer, as well as CMDV and CVMP as the list owner. The list information document is planned to be reviewed to provide more clarity and tips on how to avoid validation issues. And again, similarly to what we said for pharmaceutical dose forms and units of measurement, references to target species in SPCs and in EAF, PMS, XCVMPD, or in any structured product data should be equivalent, but they may not always be a copy and paste or an exact match because of the standardization that we mentioned earlier. And again, examples of this may be the use of singular versus the plural or other naming conventions. So for example, we could have hen as a target species in the SPC, but this is registered as turkey and then hen between brackets in RMS. Okay, so we're getting closer to the end. We only have 2 sections before we move to the Q&A. So in this section, I'll briefly describe how RMS is being used in projects and systems. So I will not go into too much detail here, but the line at the top of this slide represents the full life cycle of a product. And you can see marked with green stars the areas or processes where referential data is being consumed, and the yellow stars represent areas or processes where integration with RMS is planned. In the table at the bottom of the slide, you can see to the left side all of the systems that are being integrated with RMS. You can see an explanation on whether the data held in those systems corresponds to the human domain or the vet domain or both. And in the right column, you can see a description of the regulatory processes that are covered by those systems. What you can see in this slide is an overview of the systems which are planned to integrate in the future. In the present quarter, both UPD and CTIS went live, and they are both integrated with RMS. You can see details on what specific RMS lists these systems are consuming, but I will perhaps highlight the fact that for the legal status for the supply, the target species list, and the unit of measurement list, which are all consumed by UPD, we may expect a high number of changes in the course of the year to ensure the submission of products into UPD. Now, for the second quarter of 2022, we expect that the AZU project, which relates to sales and use data of antimicrobials, will integrate with RMS, and it will probably consume around 7 lists from RMS. This is to be confirmed. And by the way, next to the info section in every box, you can find the link to more information on the project or system that we are referring to. Also, for the second quarter of this year, we expect the creation of a new list related to GCP inspection sites, which will be consumed by IRIS inspections. And last but not least, towards the third quarter this year, we expect the integration between DADI and RMS, whereby DADI should consume approximately 8 lists from RMS. And the list where we expect more work is the legal status for the supply, as the list may need to be expanded. So in the last section of the presentation, before the Q&A, I'd like to give a quick summary on what is keeping the RMS team busy at the moment and what is planned for the future. So in terms of project work, throughout the first half of the year, approximately the plan is to prepare new lists for the DADI project, IRIS, AZU, PMS, and SMS, as well as to update already existing lists for DADI and for PMS. And in the second half of the year, and pending confirmation, we may be working on new lists for the CTIS project post go live. There's a separate work stream dedicated to maintaining and improving regulatory data services. And here we will continue with the daily data stewardship and service desk activities throughout 2022. In addition, in the first half of the year, we will be doing preparatory work to outsource part of the RMS activities, and the relevant knowledge transfer should take place towards the second half of the year. For Q3 and Q4, we also plan to work on data quality profiling and monitoring activities. And concerning the third work stream on customer experience and awareness, other than this current webinar, we are planning for an additional webinar towards the second half of the year, as well as a SPOR customer satisfaction survey, similar to the one that we ran last year. And last but not least, as mentioned earlier, we are planning to review and improve the content of the list information document for the top 5 lists with validation issues. So this is, I just have one slide remaining, but basically we'll now move on to the question to the Q&A. So I just wanted to show you a slide explaining you where you can find more information on SPOR and RMS. So in the SPOR portal, you can find reference documents such as the RMS Web User Manual, which provides guidance on the SPOR services and functionalities, the SPOR User Registration Manual, the SPOR Affiliation Template to register the first industry super user, the RMS New List template, and others. You can also find training videos on both RMS and OMS on the EMA YouTube channel, and you can see in the slide the link to the latest RMS webinar from October 2021. The EMA service desk should be used for service requests, issues, or if you need any other technical support. You can also see the link to the EMA account management portal, which you will need to create. You will need to create a new EMA account to get access to Sport if you still don't have it. And by the way, right after this presentation, there will be a presentation on this topic. And last but not least, you will find information on Sport, including important documentation on the EMA corporate website. And you also have the link to this in the slide. So this is the end of my presentation, and at this point we can move to questions. So we have 20 minutes left. You probably all logged in Slido, but here I'm giving a reminder of the details to log in. So what I'll do now is just log out from the PowerPoint and display Slido. So give me a minute, please. Okay, so I can see there are 14 questions so far. So if that's fine, I'll go in order of appearance. Okay, so can all industry users export the list or only the super users? So all industry users have the same permissions to export lists. So as I mentioned earlier, industry users have to have Spore access, and as long as that is done, then you should be able to export all of the lists which are allowed to be exported. What I mean by that is you will be able to export most of the lists, but for example, the ATC lists and the Metro list, because of proprietary reasons, you will not be able to download them as industry users. Okay. Then is there a newsletter or RSS alert to inform on modifications to the lists? I wouldn't call it a newsletter, but we have the subscription functionality that I mentioned in one of the slides. So basically, once you are logged in RMS, you can go to preferences and select subscriptions. So basically there you can select all of the lists for which you want to be notified of any changes. You can specify if you want to be informed of either major changes only or both major and minor. And you can see more details on that on the RMS web user manual. Okay, so this one is covered. The second one is covered as well. What else do we have? Could you clarify if RMS data stewards and EMA data stewards are the same or different? So in the Sport team, we have a team of EMA data stewards, and we actually have dedicated data stewards. So for example, myself, I am only a data steward for referentials, but then some other colleagues are, for example, data stewards for OMS only or for other parts. Okay, is there a consequence for, and by the way, maybe just one question for Isabel or in general, should I be able to see any replies in here? Because I can only see questions. I'm just not sure if in the meantime you have been able to reply to any of the questions.
So yes, Jaume, I think most of the questions have been replied. There's a few coming in now, and I'm replying as we speak. So if colleagues want to prioritize a particular question, please vote on it so that Jaume can cover it verbally.
Perfect. So in that case, if I say anything contradicting to what you may have written as a response, just let me know. Yeah. Let me just go back to see if there's anything new. No. Can you please specify what you are planning to outsource and to whom? Isabel, I'm not too sure how much we can say about this one.
I have replied. We can say everything, actually, very transparent. So, Jame mentioned the outsourcing, and that links to our increased demand. So, have you seen the number of change requests that we receive continues increasing, the number of lists that we need to produce for projects continues to increase, the updates to ATC lists, to MEDRAS, to EDQM, and so on. So, we rely on outsourcing to scale up our capacity. And the outsourcing team will help us to do those frequent updates, but will also gradually help us managing change requests for some lists, not for all, for the most common ones, very likely. And we use a partner called Syneos Health. That's published on the European Register of Contracts and Tenders, so it's public information.
Thank you very much, Isabel. Okay, the next one says, is there a consequence for veterinary medicinal product data in UPD if a term used for an existing product is non-current anymore? Well, I would suggest to follow up with us, but the basic principle is that ideally, valid product information should make reference only to terms which have a status current, with the exception being those legacy products, which may be very old products using old terminology. That terminology may be captured in the RMS database, but it will be marked as non-current to explain that we need that terminology for regulatory purposes, but the expectation is that going forward, companies should use up-to-date terminology. With all the work going into these lists, do you see all the systems, ARIS, DADI, linking across the platforms to each other in the future? This is quite a complex question. What I would say from the RMS point of view, all we want is for as many systems to use the data that we are maintaining, as this can help harmonize, and we have a centralized service to help all of those platforms and projects. Now, in terms of those different projects to be linked in the future, I cannot honestly give an answer to this.
If I can add to that, I think for sure there's initiatives going on to link the information in those systems via analytics. That's the first initiatives that I'm aware of. Whether we will replace them by common technologies, common platforms, as Jame mentioned, that's still to be determined. But for sure, the fact that you use the same referentials in many cases, the fact that we start relying on product information that enables us to track and trace information across different systems, and primarily we're doing that via analytics capabilities.
Thank you very much, Isabel. Okay, a comment on export of lists. We tested it today and could not export manufacturer activity. Whoops. Manufacturer activity list as industry user, but only as an industry super user. Okay, could you please raise a ticket through the EMA service desk, and we will look into it. My initial reaction is that shouldn't be that way. My understanding is that as long as you are an industry user, you should be able to export lists, and it doesn't matter if you are user or super user. So please raise a request and we will look into it. Can we continue accessing EDQM database with our username and password, or this process should be replaced by new credentials for accessing via RMS? If you are referring about the EDQM database in the standard terms database by EDQM, then that's a completely separate platform from Spore RMS, so you would need different credentials for that. I'm not sure if I misunderstood your question.
Yes, and we're not trying to replace EDQM database. They're a reference source for us. We just consolidate it in RMS and make it available together with all the lists that we need for regulatory processes. But EDQM is the reference source on standard terms, and their database is still pretty much recommended to be used.
Thank you very much, Isabel. Does a change request for an ATC code need to be sent to RMS and WHO in parallel? Okay, this is a good question. So we update the ATC list in two different ways. And I'm talking about both the human and the vet list. So we do the regular yearly updates of those lists once a year at the beginning of the year. And this is following the schedule from WHO. So WHO, who is the owner of that list, every beginning of the year, they send to us the yearly updates, and we do a bulk update in our system. So any changes coming from WHO, they will be propagated in bulk into RMS. Now, the problem we have is this is only done once a year, and differently to what we have with EDQM, we do not have an automatic synchronization with WHO for the simple reason that, as far as I'm concerned, there is no API from WHO. For this reason, if an applicant needs urgently or relatively soon a code that may have already be appearing in the WHO ATC website and needs not yet in RMS, they can then submit an ad hoc change request to RMS, and we will make the relevant checks. So we will check that WHO, although they haven't yet put that code in the yearly updates, it will already appear on the website. And further to this checking, we will be able to also publish that term in RMS. So I hope this is clear. Okay. What are the scenarios where RMS term should be deleted? If any RMS term needs to be deleted, how does EMA make sure that the term is not used by other industry, oops, this keeps moving, is not used by other industry organizations? Okay, let's take it one by one. What are the scenarios where RMS should be terms should be deleted? I would say there can be different scenarios, yeah, and it will depend on the type on the list. But a typical example would be, for example, if we are talking about old terminology. Let's take as an example, I don't know, the application legal basis list in RMS. Let's assume that there's new pharmaceutical legislation, and now there's a bunch of terms from that list that are obsolete and should not be used anymore in applications. So in that case, we will make those terms non-current. And by the way, this is probably a good opportunity to mention that we actually do not physically delete anything from RMS. All terms that we make non-current will still remain in the database for tracking purposes and for historical purposes, but the status will move to non-current or to nullified, depending on what is more relevant. Yeah? Then how does EMA make sure that the term is not used by other industry organizations? I think the short answer here is we cannot ensure this. This is responsibility of the applicants or the marketing authorization holders to make sure that the vocabulary and the referentials that they are using in their applications is up to date. Of course, whenever there is an ongoing application, there will be a review process there. And in that context, it might be that EMA might spot terminology that is obsolete, which should be updated. Yeah, but otherwise, I would say it's firstly the responsibility of the industry to make sure that their documentation is up to date. 5 minutes left. Let's see how many more I can take. How about the intended effect, please? When the intended effect will be available in RMS? Okay, this, I guess, refers to PMS implementation. So I would suggest to take it offline. Please send us an EMA, a ticket through EMA Service Desk so that we can discuss it offline, as I don't have more details on this.
Jaume, I checked this in the meantime. So the intended effect list for PMS is MEDRA, and indeed we have implemented all the MEDRA lists and sublists and variants. So whatever is required for intended effect is already available in RMS.
Okay, thank you very much. That's great. Thank you, Isabel. Are there any plans for automation notification in the change request form for requests for terms which have already been rejected? The change request form is what you need to fill in RMS. And in principle, whenever you request a term, it will give you a warning if there are any terms that are exactly the same or similar. So in principle, I think that's what your question is about. Sorry, I've lost it now. This keeps moving. For terms which have already been rejected. Yeah, so there's two things. Rejected terms may already appear in the list as nullified, for example. So I would recommend that you first check the full content of the list. And then and then the other thing is, yeah, like I said, when you submit the change request, you might get a warning saying, hey, there's this other term already in the list. Yeah. We have identified a term that is.
Jaume,
Yes.
In the interest of time, I propose we do a little break here. So we have a colleague with us who wants to go over the changes that are happening in the new EMA account management solution. And in the meantime, we can cover a few more questions that may have been left unanswered in the Slido box.
Yeah.
In the meantime, please vote again if there's any question that you would like to see addressed. So, Carlo, if you're ready.
So I'll stop sharing the Slido now, yeah?
Yes, please.